Hi, my name is Andrew Miles, and I would like to talk to you about quality healthcare in rural communities. Healthcare quality can be defined differently from individual to individual, and organization to organization, but many rural residents, healthcare quality includes ease of access, affordable services, reliability, and competent physicians. One of the major concerns of the rural population is its isolation from everything else. For many rural residents, the closest hospital is usually 20 to 40 miles away, and outside of that, it is usually a 30-minute commute. The smaller, poorer, and more isolated rural community is, the more challenging it is to ensure a readily available quality healthcare service. Some economic statistics to consider. The rural part of the population fell from 19% in 1990 to 18% in 2000 to 14% in 2005, and is predicted to continue declining in the years to come. Also, in the 2010 census, 19% of the population lived in rural America, and 23% of the rural residents was on Medicaid. The geographic isolation, lower incomes, and the declining workforce that has fewer healthcare professionals to care for them all affect the expansion of healthcare services for rural residents. By having a limited income, many rural individuals are opting to delay visiting their physician, which later leads to multiple health complications that may have been preventable if access to adequate healthcare services was readily available. You also have to consider the vulnerable population in the rural community, the ones with chronic illnesses. Because of their lack of resources, they might not be able to see their physician in a timely fashion, which could later lead to decline in overall health, or for some even death. In the end, money matters. A declining population, rise in the cost of living, a lack of adequate economic resources all affect the way that healthcare can be delivered. New medicine, new technology, new techniques, it all affects the playing field, forcing many rural hospitals to either downsize or question whether or not they'll be able to stay open in the future. Also, for many primary care physicians in the rural population, they're now refusing to accept Medicaid patients because of low reimbursement rates. On the upside, the Rural Council at the White House announced a $10 million investment plan to help develop the economic growth in the rural population, which should be successful if followed through with. Another major issue is the recruitment of qualified physicians for the rural area. Many medical students are now not willing to practice medicine in the rural population because of the lack of things to do. Some of their major concerns is on-call rotation, the number of weeks they get for vacation, being able to continue their medical education, and the closeness to transportation centers and shopping centers and cultural centers. Some other things to consider. Without healthcare clinics in the rural community, there wouldn't be no healthcare. Many home health aides now lack the necessary skills to provide care to already growing aging population or graying population. Um, Access to adequate healthcare services ranked as the number one priority for many investors and community leaders in the rural population. Also, you have to consider the trauma is more common for the rural population because of oil field drilling and logging, mining, and ranching, along with exposure to vicious bites and dangerous insecticides and even tainted water. Some possible solutions for the rural community: invest in the community by offering healthcare related jobs, and also promote awareness to the community to educate the people on preventative care and how it can benefit them. Also, invest in technology for the rural residents to help increase the use of things like telemedicine, which is communication via satellite or internet between the physician and patient, and sometimes the physician and nurse. And this would also help the chances of the physicians being able to talk to other specialists outside of their region. To get these funds, you can seek outside fundings from grants, from sponsorships, even investors, to help with the recruitment process. establish clinical rotations with medical schools to bring in physicians when they do their residency, which may lead to a chance of them actually enjoying their stay in the rural community and wanting to come back and practice when they're done. Another thing you can do is promote the strengths of a rural population instead of focusing in on the negatives. Um, in return, attempt to negotiate with them, maybe offer some incentives. And also this can be used with negotiation with companies to come in and help develop the rural community by maybe building shopping centers or other things to do. In conclusion, when it comes down to it, money is the main issue affecting quality healthcare in the rural community. In order to improve the quality of healthcare, strong investment must be made in recruiting qualified physicians, improving the technology, and expanding the infrastructure of the healthcare organization. Without some kind of economic growth in the rural community, it is close to impossible to have a superior healthcare service. You have to consider rural areas are financial liability for some, but through a community effort from the government officials and state legislatures, um, entrepreneurs, and the community, positive changes can be made and possibly benefit the collective whole. I would like to end this by stating something that Barack Obama once said. I think it was like January the 30th. President Obama said, if we seize this moment and focus our energies and the resources that it demands, there's no telling how many lives we can change. And every life matters. Thank you.